Hello, today we're talking about the procedure after bypass grafting. So bypass grafting is mainly used in case of arteriosclerosis or coronary artery disease, where it will be needed to be made a new flow for the blood, considering some part of the vessel may be obstructed, in the case of arteriosclerosis by some kind of fat. Then the graft will be taken from either the arms or the legs of the patient. This graft will then be inserted on the heart at the damaged area to be able to create a bridge for a new path of the flow of the blood. Now during the recovery stage, post the procedure, the patient is going to be directed to the recovery room where, considering it will be in a really unstable condition, it's going to have to be in a breathing tube to be able to breathe, and also having the EKG, ECG and blood pressure always monitored. After all that, after the anesthesia wears off and the patient starts to be more stable, it can be asked of them to take exercises of breathing, of deep breaths and coughing from 2 and 2 hours, and that way they can avoid any pneumonia in the future. For the first 1 to 2 weeks, the patient's only gonna be on a liquid diet, but right after that, they can start already on a solid diet. Regarding the coming back home, it's gonna be needed for them to do a lot of exercises to keep the body in movement. That way the blood can flow better throughout the body, and also in case don't be seated for too long and leave your legs up. That way that's gonna be able to avoid any swelling on the area.